Hello everyone, and this is recording for your week 4. Also, please know there's going to be a virtual drop-in on Thursday, September 25th from 11 to 12 to ask any questions, maybe for upcoming test next week. Okay, there's also a reminder that the discussion post number 2 during week 4 is open from Sunday to Sunday for you to participate, to post an initial post, and as well as replies within that week. Okay, today we're going to be talking about Jean Watson. So the agenda is briefly a review of the concepts of caring, describe Watson theory of human caring, including her development of the initial 10 curative factors, and then later switch to or change to 10 clinical curative processes. Define the key concepts of the Watson theory, learning activity and reflection that you can do on your own, and stay tuned because I have a bonus for you. So caring. What is caring according to Jean Watson? So caring as a controversial concept since the 1990s, there has been debate concerning caring as the main concept belonging to nursing. There has been some heated responses. So the questions, our first reflective questions are, what evidence do we have? Okay, as in for caring, what evidence do we have? Should nursing be the only profession that is seen as as caring? And lastly, is caring the main concept of nursing profession? Why or why not? Reflect on these as you move forward in this recording and this session for week 4. So here are some concepts with regards to caring. The first introduction was by Milton Mayfair in 1971. You don't need to remember that name. Just remember that it was in about 1970s, the first introduction. Review caring as the way by which we make order out of being meaningful to our lives. Identifies 8 major integrated of caring, such as knowledge, alternative rhymes, patience, honesty, trust, humility, hope, and courage. There's 2 theorists specifically that focus on the caring. One is the Watson, which we're discussing today, and as she published The Art of Science in Caring. And the other one, which we'll discuss later on in the semester, is Leninger. She was the first scholar in nursing to describe the caring as a center focus for nursing in about 1977. Just a fun fact, I actually saw Jean Watson myself. She came to York University a long time ago, maybe about 15 years ago or so, and I saw her. It was quite a remarkable seminar that she did. Here. So, caring. It's a complex phenomena of human experience. It is a way of knowing, a way of being, experiences differently depending on the context. So it depends where you are, right? Depends who you are, who you're caring for. It is known to be a little bit different. It is considered a natural way of human being. And Watson has most frequently been associated with this caring for the past 30 years. So there she is, Jean Watson, in the theory of human caring. Okay, here's a little bit of background about Jean Watson. She was a professor of nursing and a former dean at the University of Colorado in Denver. She undergrad and grad work in nursing, mental health, nursing, doctorate in education of psychology and counseling. She published work are used by clinicians and academics throughout the world, not just kind of Canada or US, it's throughout the world. And she first published her original work in 1979, and then later in 2008, theoretical work entitled The Psychology of Science and Caring, through the original publication up to date, including all changes made in the past 30 years. And this is where she changed to that curative processes. Okay, next slide has a video. Feel free to watch that on your own, especially the timing between 3:45 to 9:10. Okay. So Watson on Nightingale. So said that the Nightingale blueprint for transpersonal meaning and models of the transcendent history. Caring calls forth the full use of self, connecting the divine within the or without the source of inspiration, as well as foundation of professional code. And Watson also said that Nightingale made explicit the connection between the among all aspects of self, other, humanity, and environment, nature, and customs of meaning, of learning, understanding, connecting with health, caring, and healing. Okay, so Nightingale's embedded to others, as well as her kind of theoretical work that looked at the historical mind, body, and spirit. So evolution of the Watson theory, it is embedded in that cure, focus on cure, made more important than cure, and developed as a way of communicating nursing unique values, knowledge, practices, and missions of society. It is based on those 10 curative factors, then turn into those clinical curative processes that I've mentioned already. And it's a life world of experiences of persons needed to subjective and healing processes throughout. So remember the meta paradigm concepts. So let's look at through Watson's eyes what those meta paradigm look like. So person for her was the hygienic, psychological, and spiritual, unique and free to make choices, cannot be seen without context of the environment. The health is as a subjective experience of harmony, balance within the mind, body, and spirit, and related to the self as perceived and self as experienced. And remember the other two, nursing and environment. So let's look at those. So nursing for her, a human science of person and human health, illness experiences that are medicated by professional, personal, and scientific, and aesthetic and ethical human transactions. So the science and the art. And the environment is the family, culture, community, society, etc. that are interconnected between the person and the environment. So you cannot separate them. They're interconnected between the person that we discussed and the environment. Her theory of simulated within the development of caring science, which she viewed as human science of that caring, the art, the science, relationship and connection, the acknowledgement of unity of life, embraced inquiry through reflection, subjective and empirical groundwork, and has relatively into the health, education, the human science field, and the profession as well. So here are a comparison of the curative factors and how they change to those clinical curative processes. So for example, the first one, formulating a humanistic, authentic system of values, and then a change to practice of loving kindness, context in that caring consciousness. So I'll let you kind of look through here. But the first one, an example would be love looks like giving your patient warm blankets in the middle of the night, for example. Okay, so here's the 5, and here are the 10. So have a look at those. Number 6, it really is critical thinking, that those 5 ways of knowing that we talked about in the first week. Okay, the key terms that are related to Watson are caring science, curative processes, curative factors, transpersonal caring, caring moments or occasions. So those are the moments that you have with your patients, and caring consciousness, the consciousness that you have towards your patients, caring for them. Nursing occurs within the context of that transpersonal caring relationship, the healing. So this is the type of relationships that seeks the connection between embrace the spirit of others through the process of caring and healing and being in the authentic relationship. It influences by the caring consciousness of the nurses. She or he enters into the life space of another person. So think of yourself and think of you entering into that other person's life space, wherever they are, right? Could be in the hospital, in a community, at a clinic, whatever they are. Describes coming together to a nurse patient that is mutual, receptacle, and each body's is the moment while also capable of transcending at the moment. So caring, transcending at that specific moment. So here are a little bit more about caring moments and caring occasions through the eyes of Watson. So caring moments happens within the nurse and the person to be nursed, which is the patient or the client, come together in the wholeness. Each brings their own past, present, and the possible future. So think about your patients as well as yours, that past, present, and future. And both nurse and patient consciousness, freedom to choose how they would like to be cared for within the moment while connecting with the spirit level. And here is a really, really talented article about Miss Colorado in 2025, how she talks about what nurse is and the caring aspect of being a nurse. So have a look at that. It's a quick YouTube video, it's only 2 minutes, and how she stepped on the stage and presented herself as a nurse and what that means, especially with the eyes of caring. Okay, so have a look at that. Caring consciousness is the whole caring, the healing, the loving, the consciousness contained within this single moment. So at that particular moment, right? Think of that single moment. Understanding who we are as humans in the universe. It's intentional. It is the caring that we do for others. It's interconnected, caring and healing processing, connecting with other humans, caring, healing, loving consciousness of a nurse communicating with others, and caring, healing, loving consciousness through the transcendent time space that could be dominant with the physical dimensions. Okay, let's look at the strengths and weaknesses of Watson theory. Okay, so the strength, this can be used to guide the improved practice and can provide the nurse with the most significant aspects of that practice because it's at that particular moment, right? It provides that holistic care to the client, to the patient. Theory is relatively simple when you're following the clinical curative processes, right? It's pretty logical throughout as well. It has the broader assumptions provided for the framework, so it could be applied to many different situations, many different areas, many different patients. Curative factors are logically formatted through assumptions and hierarchy needs of a client, and curative factors are distinguished from medicine. So it's curative factors that are nursing and it's distinguished from medicine. The weakness of Watson theory would be Watson theory becomes more complex when entering the area of phenomenology. And many nurses may not have the liberal arts background to provide the proper foundation of the kind of lens through the Watson theory. Okay, so here is a little learning activity that you can do on your own, and here are kind of page numbers where these activities are embedded into the 5th edition textbook. So comparing the curative factors versus curative processes, transpersonal caring relationships, and it's on page 318, transparent caring moments and caring occasions, and unitary caring, which is the healing consciousness. So have a look at those, understand and define them, what they mean, and how they relate to this particular theory. Okay, I am going to conclude that week 4, remember to do your discussion post this week. Week 5 is in-person test number 1. It focuses on week 1 to 4, including Watson. And week 6 is an online. We're going to focus on Roy, and you have discussion post number 3 then. And fall study week is October the 13th to the 19th. So this is just a little thing for yourself. And here is my bonus. So my bonus are a couple questions from Jean Watson that you might or might not see on your test number 1. So according to Watson, consciousness is what? What do you think? I'll give you a moment. If you answer E, all of the above, you are correct. How about this one? Transpersonal caring occasion occurs whenever what? What do you think? I'll give you a moment. It's C. The nurse and another comes together with a unique life histories, right? Remember how I talked about the present, past, and future, and it's both for the patient and yourself. All right. You must study day and night, while those were the 2 main times for me, right? School. Anyways, good job, everyone. Thank you so much, and good luck on your studying. Good luck with working through week 4, and see you next week.